Alright, hey guys, Dr. Brian Wickstrom here with River City Chiropractic, and in this video we're continuing our series addressing lower back issues, okay? And so one of the things that's super important to helping you figure out what's going on with your lower back pain is to have a thorough evaluation done. And so in our office we do a history, which we're looking at things that may have happened in the past, maybe going on currently. We do an exam looking at any sort of range of motion deficits, orthopedic neurological testing, things like that. But one of the other tools that we do that's very important, I feel, is having an x-ray done. If you haven't had an x-ray in your spine, you don't really know what's going on. There may be other issues going on there as well under the surface. You know, sometimes people have funky anomalies going on that you may not even know about. And so when we look at an x-ray, we also want to see your spine. Your hips should be nice and level, and then your spine, this is your lower back from the front, so your spine should be nice and straight. Okay, if it's not lined up properly, so if your hips are off balance or the vertebrae out of alignment, that again is what a subluxation is. And when that happens, that irritates the nerves, and that can be causing the back pain that you're dealing with. But as we talked about in other videos, over time, then the longer that your spine's out of alignment, the discs and everything starts to break down, and it leads to more of a chronic issue, which makes it more challenging to correct. And so in our office, in addition to doing the x-rays as your initial exam process, we also do follow-up x-rays. So after a period of treatment in your office, then we're able to see that your spine and your posture is improving, and we're not just basing it all solely on how you feel, okay? And so this is a real life patient here in our office. So he's in the military, and prior to coming in to see us, he had been to 2 or 3 other doctors that basically told him that he's just getting old. He's going to deal with lower back pain for the rest of his life, essentially, and they gave him several different medications to cope with the depression and the pain and everything else. So fortunately, his sister sees a chiropractor down actually in Georgia, and so he was referred in to see us, and we're able to find out that his lower back pain that he was dealing with was actually coming from his spine. It wasn't something that he was going to have to deal with for the rest of his life. He was only 37 years old. And so his hips are off balance. Here you can see his right hip is lower, and because his hips are like the foundation for your spine, his spine was leaning all over this direction. That was damaging his nerves here in his lower back. Okay, and so we started him out on a course of treatment, of coming in, getting adjusted, exercises at home, and we also he had some bulging discs as well, so we had him doing our decompression therapy chair, and this is over about 3 months of his new re-x-ray. So his hips are balancing out. You can see his spine's pretty much lined up perfect where it needs to be there now, and because of everything that we're doing, he's about 80 to 90% better as far as his pain goes. So he's not taking any of the medications. He got off those shortly after starting here. And so this is, the way it should be. And so a lot of times people are told that they're just going to need to deal with these problems for the rest of their life, and that is not always the case. And so there may be issues or things that we can help you address here in our office. And so hopefully this video was helpful for you, just to give you a little perspective on some of the things that we do to help our patients here. And if you have any questions, concerns, feel free to reach out to us, and we'll see you in the next video.